Hello everyone, my name is Joao Flavio Nogueira, and on behalf of Dr. Moaz Tarabishi, I'm here to present this small lecture regarding the history of endoscopes in our specialty in otolaryngology. Well, I'm from Sinocentro, from Brazil. This is my email, and this is the city I'm from. I'm from Fortaleza. It's a 3 million city right at the Atlantic coast of the northeast region of Brazil. And I'm going to tell you a story, the history of light, and how light or how it changed the history of our specialty. And I would like to start with this phrase: there's no difficult surgery, there's bad light and bad exposure. And the history of endoscopes is basically the history of light, or putting light inside our human body in order to see things, to diagnose conditions, and to treat those conditions properly. So, in the history of ENT, our history starts here in Frankfurt. This is the city, the landscape of the city of Frankfurt in Germany. And this is the Frankfurt Cathedral. And after World War II, the Frankfurt Cathedral was destroyed during the war. And the Germans, they built again the cathedral. It's a very nice and Gothic cathedral. And while they were rebuilding the cathedral, they found the graveyard of this doctor, Dr. Philipp Bozzini. He was German, although his Italian last name. The history about his last name is his father was from Italy and his mother was from Germany. They got married, his father and his mother, and they lived in the northern part of Italy. But Philipp Bozzini's father was challenged in a duel, while his mother, was still pregnant of him. So in that duel, Philipp Bozzini's father was killed, and his mother flew back to Germany in order to live with her parents, in order to raise Philipp Bozzini properly. Although he was born in Germany, the mother, kept the Italian last name, Bozzini. So Philipp Bozzini was German, but with an Italian father and Italian last name. And they found the graveyard, the gravestone of Philipp Bozzini. And in this gravestone, some words were carved, like, "To the devout soul of Philipp Bozzini, Doctor of Medicine, who was the first one to explore the inside of organs through his ingenious light projector. He was able to tenaciously fight fever in other people with a great sense of duty, and succumbed on the night from the 4th to the 5th day of April 1809. In his 36, he was very young when he died, year of life. His faithful friend, we never know who he was or she was, FF." But Philipp Bozzini, and this is a copy or a facsimile of his grave stone or graveyard, but Philipp Bozzini invented this device, this light projector. The candle would go inside the device. The fire of the candle, reflected in mirrors inside the device, would reflect this light into this device, who was put inside the vagina or the anus or some cavities of the human body. The smoke came through this superior orifice, and you would put your eye on the other eyepiece of the device. It was a very complicated device to operate, but was the first device of its kind in order to examine, to look, to put light inside the human body. And he was also a visionary, and he thought about this device, and he said, no, surgery will gain not only from new operations, but all other uncertain operations which depend on mere luck or chance. So he was creating an instrument, and he was actually thinking that in the future this instrument could be used to other specialties and would help a lot in the development of medicine in our specialties. But as all innovative guys, he had some powerful enemies. And Dr. Andreas von Schift, who was the head of the Viennese Medical Center, was one of his criticized guys. So he said, no. This endoscope thing, this is not useful. We think the finger will still remain as the sole mean from which the patient can expect fitted treatment. And of course, history repeats itself, but he was a little bit wrong. And for the sake or for the good of the medicine, endoscopes or light tubes, just like Philipp Bozzini's but with some modifications, started to be used in order to put light inside the body to diagnose certain conditions, especially in the stomach area. So those light tubes were inserted without anesthesia. It would be very uncomfortable for the patient, but doctors could see and could diagnose and could treat some diseases because of this instrument. And in Germany also, Dr. George Kilian from Dresden, in 1902, he was the first one to try to use an endoscope or an instrument like an endoscope to do the first laparoscopic surgery. So he was one of the pioneers of endoscopy, including esophagoscopy and gastroscopy. So it was a very nice history. ENTs were shown, endoscopes were shown for the ENTs in 1904 for the first time, and this is the California Medical Journal. And some ENTs, they said, okay, endoscopes are very interesting gadgets, but at this time they do not have any clinical use. So it's a very nice history about the gadgets that sometimes come in our specialty, and sometimes we discredit them, but most of the times those gadgets can be used, and we find some indications for those gadgets, and history repeats itself. And this is the Endoscope, one instrument that was developed using the basic concepts of Philipp Bozzini in order to see inside the maxillary sinus. And this is Dr. Maxwell Maltz from New York, who was one of the first ones to try to develop this instrument with the company in German in order to put light inside the maxillary sinus to see other things. But the history of our specialty changed again in Paris, in France. Why? Because of this guy, Dr. Manuel Garcia. He was actually not a doctor, he was a singer. His father was a great tenor from Spain. He was also from Spain, but he lived in London. And he was spending his summer vacations in Paris. And walking by the Louvre, he saw the sunlight reflected in the mirrors of the Louvre, in the windows of the Louvre, reflected in the other walls of the building of the Louvre Museum. So he had the idea, and he went to a dentist shop, and he bought a small mirror. And put this small mirror against the sunlight with another mirror, and could see for the first time his own vocal cords, to see the organ who produced the sound of his voice in order to try to teach for his student. He was a great teacher. So he went to the Royal Academy of Medicine in London to tell about his discovery. And they said, no, you're not even a doctor. How dare you say to us, doctors, the Royal Academy of Medicine, that this mirror is a very nice instrument in order to diagnose. No, we don't need this mirror. But he went to France, again, for the French Academy of Medicine, and they said, oh, it's a nice instrument, a nice piece, idea to put light in order to see your vocal cords. We will adapt your instrument and we will start to use. And in other countries in continental Europe, they started to use variations of Manuel Garcia's mirror, so they could diagnose, they could see, and they could treat some lesions of the vocal cords. But of course, this for many years was considered the symbol of ENT, the Garcia mirror and the frontal mirror, who was used by many ENTs. And the history of our specialty is the conjunction of those main big specialties. The laryngoscopy was the first specialty to put light inside our organs in order to see the larynx of the patients, and the otology, which was always the mother science of ENT, of ear, nose, and throat conditions, diseases. And as you can see in the old papers, there was no rhinology at the time. It was laryngoscope, or archives of otolaryngology, head and neck surgery, clinical otolaryngology, journal of laryngology and otology. Was no rhinology at the time, and some doctors still think that there's no rhinology, there's no specialty called rhinology. It's just a conjunction between otology and laryngology. But the history changed again in Berlin, in Germany. Why? Because of this guy, Dr. Kilian, Gustav Kilian. He was the head of the Berlin University ENT department, and he started to use rigid endoscopes in order to look inside the nose and look inside the throat in order to see new conditions. And because he was using the endoscope, he was able to identify some conditions that were never described before, just like the Kilian polyp, the polyp that arises from the maxillary sinus and is found inside the nasal cavity. Because without the endoscope, this could not be seen very easily. So he was the first one to see and the first one to describe and name the Kilian polyp after him, of course. But this is the picture, the posterity picture of Gustav Kilian and the department. And as you can see, Dr. Gustav Kilian is here in the center of the picture, all the professors, all the students here. And he, although he used the endoscope, he's not showing the use of endoscope because endoscopes were a sacrilege or profound. The guys who use endoscopes were crazy people. So for the posterity, he's showing the symbol of ENT, which is the frontal mirror, as you can see there. The frontal mirror, all the professors are showing the frontal mirror as the symbol of ENT. But this is the video of Dr. Julius Lempert, a famous otolaryngologist. He was actually born in Poland and raised in America. He was a very famous, considered by many doctors, the founder of modern otology. Professor Lempert was famous because of fenestration operation for otosclerosis, but here he is performing a septoplasty without endoscopes, without any kind of different lighting, just with cocaine as topical anesthesia, and no gloves, no antibiotics, and he's using some instruments that we use until today. As I told you, history repeats itself, and history is very nice in order to know, because we can see what the historian great guys of our specialty did in order to try to repeat the correct things that they did, and to don't repeat the errors that they may committed in the past. So he is elevating the flaps, the mucoperichondrial, mucoperiosteal flaps, removing with a Balanga knife the cartilage, the nasal septal cartilage, and now he is going to remove some remaining bone of the vomer and the perpendicular plate of the ethmoid. And remember, no antibiotics, just the frontal mirror, which was the symbol of ENT. He removed the quadrangular cartilage, a part of the deviation, a little bit more of cocaine in order to do a vasoconstriction. And now he's going to remove the remaining plate of the ethmoid bone and the vomer bone. Now he's removing using a Brunings, an instrument that we still use nowadays in many countries throughout the world. So he's removing, and he was a very famous doctor. Now no packing, just a towel, next customer please. So it was very fast and was very simple operation for him. But the history changed again, the history of endoscopes changed again in London, in England. Why? Because of this engineer and the love of English people of polo. So after World War II, BBC started broadcast polo games in London and throughout England. And as you can see, the polo matches, they require a very big field because of the horses and stuff. And the ball is very small, so we could not see the ball. And people started to get frustrated because they could see the horses, but they could not see the ball. So BBC went to this engineer, Howard Hopkins, and they said, Dr. Hopkins, you're very clever, you're very smart. We have this problem. Can you solve this problem for us in order to get an image closer in order to see the ball? And Hopkins developed the zoom lenses. And he patented it, and he was very rich because of it. And he started to go to VIP parties in London and throughout Europe and throughout England. And in some of those parties, he met some doctors. And the doctor said, Professor Howard Hopkins, you are very smart, you're very clever, you develop zoom lenses. We have this problem. We need to see the organs of our body, but we cannot because we do not have some instruments. Can you try to develop an idea, because you're very smart, in order to solve this problem for us? And he went with his Pakistanese student, and they developed the fiber optics. And the concept of coherent and incoherent fiber optics in order to put light inside to see the image that the light could show for the first time for us. But Professor Hopkins was very smart, but he never thought about getting an instrument to record this image. We don't know why, but he never thought about an instrument to record. So when the doctors start to use this flexible endoscope, But when they went to congresses, to medical congresses, they say, "Oh, I have this instrument," but they could not show images. They could not prove that they were right because Dr. Hopkins did not had invented image capturing device. But in New York, Dr. Rudolf Schindler, he talked to Dr. Hopkins and improved a little bit his invention, and he developed an instrument in order to capture the image for the first time. So this is the first time that one image for a prototype instrument, a stamp showing President Lincoln, and this was in 1975, not many years ago for the history of medicine and history of mankind. So this instrument, this flexible endoscope, was started to be used in otolaryngology, but the device was not very user-friendly. So it had a helmet with a very heavy helmet with a light source and a flexible endoscope, and they started using also in surgeries, but the results were not very good, so it was abandoned. But a famous urologic surgeon from Europe, from England, started asking Dr. Hopkins also to develop a concept, an idea for rigid endoscopes, because the rigid endoscopes that they have at the time were very fragile, because they did not have wide angle, because they were glass lenses, vacuum, glass, vacuum, glass. So if you bent a little bit this endoscope, it would break. But Professor Hopkins had a great idea to use, instead of vacuum, to use lenses. So lens, vacuum. The vacuum was a very small part. Lens, vacuum. So the endoscope was a very rigid and very robust instrument. So he developed this concept, and this is the concept, basic concept of the rod lenses that is still used until today on the endoscopes from Storz and endoscopes from other companies, especially from Storz, that they use this endoscope, and which is one of the best endoscopes that you can have, the rod lens concept that was improved by Mr. Storz, very nice craftsman in Germany. And Storz was also responsible for popularizing this endoscope and also for the use of this endoscope in ENT. Why? Because he had a friend in Graz, in Austria. Graz is a city in Austria near the border with Germany. And in Graz, there was the surgeon, Professor Messer-Klinger. And Professor Messer-Klinger knew the endoscope because Storz showed him, "Oh, this is an instrument that I'm making for some guys. Can you use this instrument?" And he showed the endoscope, and Messer-Klinger liked the endoscope and started using the endoscope in order to see and in order to perform some small surgeries. And in Austria at the time, it was possible to smoke during the OR, during surgery. So while performing surgery, he was smoking, and a little small piece of ash dropped inside the nasal cavity of one patient. And he saw the mucociliary clearance, and he was the first one to try to get an idea, to get a concept of functional endoscopic sinus surgery. And he published a book on this, on functional endoscopic sinus surgery, which was the first book to bring the concepts of endoscopic sinus surgery, of using endoscopes in ENT, of the transition space, of understanding the mucociliary clearance and not removing completely the mucosa in order to treat patients with inflammatory disease or inflammatory conditions in the sinus and nasal cavity. And this is the posterity picture of Dr. Messer-Klinger. Although he was using an endoscope, it was still a blasphemy to say that he was an endoscopic surgeon. So he is showing for the posterity, okay, I'm using an endoscope, but I'm also an ENT with the frontal mirror. So it was the symbol of ENT. But he had a student, a very nice student called Sternberger. And Sternberger pushed a little bit harder with Dr. David Kennedy from America, the concepts of functional endoscopic sinus surgery, and this is a posterity picture of Dr. Sternberger. And as you can see, for the first time, ENTs do not choose or do not use anymore the frontal mirror. They only use the endoscope. It was a symbol of ENT right now. Endoscopes went from nothing from gadget to the most important instrument, or the symbol of one specialty, which is ENT. And of course there was the primitive eras, the optic eras. Now we are in the electronic era, and endoscopes can help a lot. Among with cameras, high quality, high HD cameras, can help a lot the understanding of the disease, the understanding of the anatomy, and the treatment of most inflammatory conditions, and also nowadays tumoral conditions in the sinus cavities, nasal cavity, and now in the middle ear cavity with endoscopic ear surgery. In the future, or in the present now, we still have the intelligent ORs, starts making nice intelligent ORs, augmented reality, which is a very nice concept for the future in order to use the endoscopes along with image guidance system in order to help in real time the performing of surgeries. Also, robotic surgeries that use the endoscope for performing some surgery, and this is an experimental use of a robot to a pituitary surgery. Also, the use of other endoscopes or other quality 3D endoscopes in order to improve the depth perception that we do not have on the current endoscopes that we have nowadays, and other types of instruments that we can use in order to perform safe and effective surgery. So we have nowadays a toolbox full of instruments, and the most important of them in our present time are the endoscopes. And endoscopes can help a lot. The sky is the limit for us right now. We do not have limits. Endoscopes provide us a beautiful view of the anatomy of the nasal cavity, paranasal sinuses, middle ear. New structures actually are being discovered each day that you use an endoscope. Ventilation routes, the concepts of nasal aerodynamics, the concepts of middle ear ventilation routes. This is very important. So this is a paper of the same California Medical Journal of 1904. Corner from the septum of corner, efforts of entering the article and entry through the sternolauditory canal cannot help but arise our interest. The day may be near, but with our increasing knowledge of these parts and improving technique, when this operation will not be considered as ill-advised to avoid under certain conditions to more radical and disfiguring procedures against the mastoid, its analogy to vaginal hysterectomy and cranio-ovariotomy is interesting. So these were some predictions to the future made by some important guys in our world, just like Bill Gates or Ken Olson or Thomas Edison. And as you can see, to predict the future is very hard, and neither one of us is able to predict certain the futures. But one thing I guarantee you, the best way to predict the future is try to create. And that's what we are doing, trying to create a future with using the endoscopes in order to put light, in order to see things, in order to diagnose conditions, and in order to offer the best available treatment for the most important of all, which is our patient. So thank you very much, and hope to hear from you soon. Thank you.